I wouldn't wish this on anybody. Maybe Hitler, but that's about it. My name is Gina, and I lost half my cheek and my lower eyelid from what I thought was a simple injection. Instead, I got injected with silicone. Some nasty was put in my face, and I was devastated. Silicone is just, it wreaks havoc on your body. Looked like I had this huge alien popping out of my face. As a female, like, your identity is your face. My sense of self-worth was just demolished. You just feel like kind of like your world has ended. Or like, why did this happen to me? Like you wish you could get a, time machine and go back and, wish you could change. Just those minutes or just one little procedure just totally derailed my entire future.
What are you doing? Is that an otoscope thing?
It's for earwax. It has a camera. It's like a friggin' forest in here.
Ew. Disgusting. Trust me, do not show Brittany that. You will never have sex again. I promise you. By the way, you want to hear something crazy that I just developed?
What'd you develop?
A hemorrhoid.
Terry, I know we're close, brother, but I don't want to hear about your friggin' hemorrhoids.
My ears are clean. Let's check out my hemorrhoid. Wait.
Oh.
Check it out.
Oh my God, look at that. That is the hemorrhoid. Look at that thing.
Look at that. As a board-certified physician, I want to tell you very clearly, never stick anything inside your ear canal. It may do serious damage.
Please, I just got lightheaded.
Smell it.
No, get away from me.
Smell it. However, you want to stick it up your ass, go ahead.
You know when you've actually told me that a picture really says it all?
A picture is worth 1,000 words. Oh my gosh.
She got injected, and this is what happened to her. This is her today.
Whoa.
She's got a major, major, major problem.
Wow.
Can you please send in Dr. Anderson?
This is a doctor? Holy.
Hello.
Dr. Anderson.
How are you? What do you want us to call you?
Gina.
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 And I'm Dave.
My brother in Oregon, I've seen all the specialists and they can't help me. So I need to go to the best to get help. And Dr. Nassif and Dr. Dubrow, they are some of the best and most knowledgeable people when it comes to silicone complications.
What kind of doctor are you?
Neurology.
Those were the smart ones in med school. You know what they used to say about surgeons? They know nothing and do everything, and neurologists know everything and do nothing.
So Gina, looking at these photos, please take us back because, you're a doctor. We're kind of a little lost how this happened to you.
Yeah.
Mm-hmm. Well, actually, a colleague offered to do filler for me. It was like, I'm in my 40s. I'm going to look a little bit better. And I thought I was getting Restylane or Juvederm.
What was it?
It was silicone.
Ooh.
Obviously, is something that's not FDA approved and illegal to inject. Both cheeks? Anywhere else on the face?
Yeah, it was actually both cheeks I was injected, but it turns out there's no silicone in my left.
What? But
So we think it was 2 different injections.
Yeah, or 2 different products. We're not really sure.
isn't there a notation exactly what was injected?
Mine was lost. Yeah.
The whole chart.
Yes.
So when did you exhibit symptoms?
Like around year 4.
Year 4, boom.
All of a sudden it just went boom, and then there's just huge granulomas.
Yeah, in a day or a week or what?
And almost like in just a couple days.
When you get a granuloma, which is a foreign body inflammatory reaction, that typically happens within 6 months to a year. The fact that Gina didn't start developing those granulomas till way later indicates it's a very slow, smoldering, inflammatory, chronic response that potentially could be very, very difficult, if not impossible to treat. How many separate operations do you have on this area?
I had 5. The first one wasn't bad and just removed the granuloma, but then it came back. So 4 months later, they tried to get the silicone out, and that didn't work because the granulomas came back.
It just kept coming back and forth.
And then a month later, it just got so much worse. The granulomas actually made a hole in my cheek, a big hole.
Yeah.
They actually did a flap to the lower eyelid area to reattach the skin. Then a year later, it was the same procedure, a local skin flap. And then less than a month later, to clean it out again because the granulomas came back.
When was your last surgery?
It was June of last year. I think there might be some silicone, but the granulomas had really decreased a lot.
In the process of all this, what happened to your practice?
I had to close it.
Oh my God.
When you can't sleep and you're in constant pain, it's hard to, think on your feet all the time. And
Yeah.
So you have chronic facial pain.
yes.
This isn't like just me looking like slightly pretty. I mean, this is like I'm in agony, I don't sleep. My hair started thinning, kind of like a hair loss, and I just started feeling kind of like weak and fatigued. It's been a nightmare.
How many years did you actually stop the practice?
2 years ago.
2 years ago.
Just seeing her, all the things that this has cost her has been very devastating. Gina's afraid to even hope because it's just been such a long slog through sort of the valley of despair.
What are your goals now? What would you really like to have happen?
To restore my appearance would be great, and also decrease my pain. It's
And
really,
who would have thought a simple injection would lead to years of this?
I know.
And let's say somehow we're able to do something for you. Can you think about getting back into medicine if we made you better?
Heck yeah. That would be wonderful.
That would be so incredible that if we can do something to actually get you practicing again,
Yeah, we got to figure
Yeah,
this
most
out.
definitely.
figure it so that we can actually get your life back. Okay?
That would be
Let's-
great.
awesome.
Thank you.
Let's go do that. Here's the main focus right here, right? This tissue right here, and that scar right here. We're looking at the bad tissue that needs to be removed and thrown away. You have a complex puzzle. So, thinking about this, starting with the eye. We have to add some volume to that lower eyelid, okay? I have a buddy I've known from college. His name is Dr. Guy Masry. He's an oculoplastic surgeon, so I need that specialist to help me do that. That area of that triangle there, you're having chronic pain there, we need to somehow free up that nerve. You have a little bit of belly fat.
Yep.
So maybe we take a little bit of that belly fat and we have to add some volume underneath here. Now, I can tell you now this is not gonna be easy, and this is extremely complicated. Who knows what can happen? Playing with silicone, because it's like playing with fire. There's a lot of high stakes here because I'm not gonna know if all the silicone is gone, possibly in surgery, but most likely after surgery, because we have to see how her face reacts. She can get granulomas, she can get collections of fluid called seromas. Any of these things could happen after surgery, so it's a big mystery. Would you be happy with a 30, 40, 50% improvement?
Yes. I just like anything to get better. As a doctor, I'm actually pretty nervous. My case would be considered a zebra, which means that it's something very exotic, a case that you pretty much never see. But I feel like I'm in good hands.
So, we need to put our heads together, knowing that it's going to be extremely difficult surgery.
You need extraordinary measures for an extraordinarily complex problem.
Doctor?
Doctor.
Doctor.
Hi, how are you?
Hi, how you doing?
How you feeling?
All right.
All right, so you know Dr. Peng, and then this is Dr. Masry. We have done a lot of these complex cases together, and this is one of his fortes. Again, this is very complex, risky surgery. For Gina's surgery today, my team and I will begin by removing the scarred down skin under her right eye to free up the nerve and hopefully stop her pain. Then we are going to harvest tissue from her stomach to create a dermal fat graft and rotate the malar fat pad from her lower cheek to fill in the defect and give her volume. Finally, Dr. Masry will perform a closed canthoplasty so that the corner of her eye is symmetric to the left side. How are you?
Actually pretty good.
So, do you mind if I touch your upper eyelid? I just want
Yeah,
to feel
that's
that.
fine.
That's all from the lymphatics not draining right now. All right. Remember you had an area of necrotic skin that was really bad? Once I cut out that tissue, that's when I started finding some unusual things.
Really?
I found a foreign body, like a piece of gauze, in your
What?
sinus.
Oh my gosh.
So we took that out,
How in the heck did I get gauze in there?
probably from one of the other procedures. How's the pain you had?
Yeah, it's a lot better.
Really?
Yes, I'm actually able to sleep now.
We're not out of the woods yet because one, I don't want that wound right here pulling apart. I don't want you getting an infection.
But did you see any silicone at all or no?
I didn't see that.
I'm just really grateful that I have a chance now to reclaim my life because things were starting to look dismal. This is the best I felt in a long time. So I'm just really crossing my fingers that this is finally the end of my personal hell.
I've been in this game a long time.
Yeah.
This is really
It's amazing.
really impressive. I mean, this is like super sophisticated. This is a giant
I
step in the
know.
right direction.
It's been, yeah, thank you so much. Thank you. Unfortunately, I'm heading back into surgery today. The last few months have been difficult. The surgery looked great in the beginning, and then I started to have a recurrent swelling, which is a seroma in my cheek that was minimal at first, and then it just got worse. It's actually pretty painful. And I've been having trouble with driving, reading, and sleeping. That kind of really erodes your spirit. And I'm nervous about it, and anything's possible, what could be causing the swelling. So we'll see what Dr. Nassif finds.
Okay, so let's talk about this for a minute. As you know, she was doing great.
Yep.
And then she has had recurrent problems. She's been out here for the last month. You two drained her
Many times.
many times. So we thought that would help with compression. Conservative treatment, that's the way to go first.
Absolutely.
It hasn't worked. Following Gina's surgery, she has had multiple problems, what we call recurrent seromas. For the last month, every week we've been draining off a seroma, which is so unusual.
Hello.
Young lady.
Oh, well,
how
thanks for
are
calling me
you?
young.
Well, now especially young, because you look fantastic. How's your eye pain?
My pain has gone down significantly. It's almost gone. And so I don't have that horrible, just agony.
Good.
So just got the pathology back. It just was foreign body. So that must mean that a little bit of that old silicone you had injected caused this massive weird reaction.
Wow.
Wait until you see it.
So the tissue looks pretty healthy.
Wow, it looks totally unbelievable.
And it's looking better, like even morning to night, there's just like improvements like within 8 hours. And it's just, I'm just unbelievably happy. Silicone can be impossible to remove, but thanks to Dr. Nassif, we have it removed in the cheek area. My energy level is increasing, and actually my mood has gotten better. My hair loss has stopped, and actually my hair is starting to grow back. My thought process is actually getting faster. I mean, it's just a miracle. I was having all this really bad joint swelling, and it's gone. I was having like daily nausea, and it's gone. It's just life-changing. I think that this is the highlight of just such a rough part of my life.
And this is why we warn patients all the time. Don't have anything illegal injected in your face or your body, because we don't know the long-term effects, and it really ruined you. It destroyed your life.
Yes.
But here's the horrible thing. We still see in our practice all the time patients that still do it, day in and day out.
All the time. You would think after all these years of us warning people not to inject foreign substances from hardware stores or plumbing supply stores that we'd see less. We see more.
Like,
Yeah.
see, I didn't know this was happening to me, and that's the thing.
And hopefully it's over.
I hope so.
Let's hope so. I'm just so grateful. Thank you so much.
I hope to God, because don't we start seeing patients again?
Congratulations. It's good. You're in a good place. I'm so happy for you.
I would like to practice medicine again in the near future. I'm just so grateful that they chose me to help. I mean, this will give hope to so many people, because when you have like hardly any hope, it's so hard, and you have to look for like beauty every day. And now when people see it, they'll actually have hope, and that's what we all need. So thank you.
Yeah, you look good. The only thing that would make this better is if I had done this.
Exactly.
Don't inflate his ego.